here's a question for you. Do you often notice your child or grandchild sitting close to the TV or tablet screen? Do they rub their eyes a lot while looking at books? Well, these could be signs that they have trouble seeing. And we talked to Dr. Odell Owens about the importance of having your little one's vision checked and corrected early. Take a look.
See a lot of kids at 3 and 4 who are actually going to preschool. So they certainly need their eyesight so that they can perceive the world, that they can see the correct colors, that they can see the correct kind of movement, that they can be engaged and not have fear that the world looks different for them. But in real terms, they need to learn to have good eyesight so they can learn their alphabet, so they can learn how to count. And in return, that allows them to learn how to read. From the data that we can gather now, probably about 10% of children have eye problems. However, young kids tend not to relate that to the parents. They don't, because they're so young, they're not going to say things a little out of focus or things don't look quite right or not realizing things not as bright as it should be. So I think by testing, there are far more kids that need to have visual attention and visual treatment than we think. Certainly one of the most common and earliest signs of a child sitting real close to the TV or holding the book very close to them because they're not seeing it very well. Other signs can be tilting of the head where they're favoring sight through one eye versus the other one, rubbing their eyes because again they're not seeing it as well, so they think by rubbing their eyes it'll give them a clearer picture. Oftentimes they don't want to color because they can't stay within the lines and it's frustrating for them. And sometimes they'll have sensitivity to light. And also these kids don't want to do puzzles because again, they can't place things exactly right because things are kind of fuzzy. And sometimes they're seeing double. If your child exhibits any of these symptoms, the earliest that you can make that diagnosis, the better you are for your child to have those corrected. And that child then can be fully engaged, especially at 3 or 4 where they're in preschool, getting ready for their important grade of kindergarten. We strongly believe in school-based health centers. We believe that providing health care to kids while they're at school will allow that child to miss less school and be a better student and then hopefully graduate. Part of that process has also been to add vision and dental. We strongly feel that these young children, especially starting at age 2 and 3 who may be in this preschool program, need to have their eyes examined, as well as continuity of having their eyes examined throughout the rest of their school time at that particular school. We're fortunate that Interact for Health has been able to have good partners, that we can provide comprehensive health care and comprehensive vision. When I mean comprehensive, we have all the equipment that one needs to examine an eye, and then when it's determined that that child needs a pair of glasses, the glasses are brought to the child at that school. Therefore, the child's not missing school, and the parents, more importantly, are not missing work.
Wow, that's a great program. Well, for more information on how to keep your kids healthy, you can give Interact for Health a call at 888-310-4904 or check them out online at interactforhealth.org.